Mario Lopez. We have a very special guest with me today, Dr. Simbiat. Am I pronouncing that correct?
Yes, Dr. Simbiat.
Simbiat, pretty name, but we'll just go with Dr. Sim. She's the founder and CEO of, I hope I'm pronouncing this correctly, Conscientia Health, a global mental health practice.
Yes.
Awesome. Thrilled to have you. So I think it's safe to call you a leader in the mental health field.
Yes, some people say so, yeah.
Oh, look at that. That's so incredibly impressive. Parents must be so proud. Tell me about the, am I pronouncing that correct? Conscientia?
Conscientia, yes.
Conscientia Health approach to mental health.
Sure. So at Conscientia Health, we take a different approach from most practices.
Okay.
Now, the top 3 issues that we have in the US when it comes to mental health care is accessibility, affordability, and timeliness. And so at Conscientia, what we do, we make sure that we're easily accessible, so you can book us online at any time, just one click, appointment is booked anywhere in the country. We're actually in 33 states in the United States right now, and 16 countries globally. And so easy accessibility, one click, book your appointment. Affordability, we accept insurances. Very rare to find psychiatric practices.
That's awesome, and I'm sure you know mental health issues have become more prevalent in recent times, especially here in the States. What do you think are the top 3 issues that we face here in the U.S.?
Sure. So in the U.S., the top 3 mental disorders that we face are anxiety, depression, and substance abuse. About 40 million Americans suffer from anxiety disorders of any kind. 16 million have at least had one major depressive episode in their lifetime, and 20 million people suffer from substance abuse disorders. So it's pretty prevalent.
It is pretty prevalent. Good for you to get into this space. And Conscientia Health subsidiary called Spotlight, I hear, is all the rave right now. Can you tell us more about it?
Sure. So during the course of my practice for the last 15 years, just give a little backstory. Started on Wall Street, right in the middle of there. And so imagine being a psychiatric
Dr. Sim, you're like a renaissance woman.
I know.
You're incredibly impressive.
Thank you. And so started right there for everyday people. You know, when people think of mental health, they think mental health. No, everyday people, just like you and I, doctors, lawyers, Wall Street, I started off at. And so what I found was that the pressure that comes with being in the spotlight, whether you're a leader, an executive, an athlete, an actor, it's a little bit different from the pressure that comes with being an everyday person. And so what Spotlight does with the name is providing specialized mental health care to anyone in the public eye, right? And so we want to deal with the pressures that come with that. We want you to be able to manage your personal life and still be able to manage the life that you live in the public.
That's fantastic. That's fantastic.
Thank
Such
you.
valuable stuff right there. And I'm sure social media plays a significant role in mental illness, especially with young people, right?
What we do is we try to mitigate the negative aspect of social media. Social media is there. It can be anxiety inducing when we spend too much time on it. And so a lot of people are there anyway. What I do is I make this thing called 1-minute mental health videos, basically to educate people as to what the signs and symptoms are for mental disorders that they may not even know are mental disorders, right? So I make these videos, I educate, I provide hope through the videos. I get lots and lots of messages about how that one little video helped me find help, to find a mental health professional. And so social media can be a negative, but we try to utilize it as a positive.
Yeah, it does have positive elements. I'm glad you mentioned that. That's so smart. So what are your future goals for Conscientia Health, and how do you envision mental health care?
Sure. So future plans for Conscientia Health, we're hoping to do the same thing that we've done in the US globally. Easy accessibility for mental health care. If someone is in the middle of Timbuktu, as long as they have internet, or you're in the middle of Texas somewhere, you have internet, the goal, our future goal, is to make sure that most people have access, whether it's via virtual care or in person. And so like I mentioned before, we do provide virtual care right now, hoping to expand that into different other countries. And then finally, we want everyone to treat their mental health as they would their physical health, because it's the same.
Yes, you can't separate. You're exactly right. You got to work out both. But before we wrap up here, Doctor, could you share maybe a few tips to help our viewers maintain their mental health?
Sure. A few tips. 1, self-care. It sounds like everybody hears about self-care, right? But then the key thing is prioritizing, no matter how small the time is. Once a day, every day, putting a daily routine to practice some form of self-care. Anything you enjoy doing. It could be reading a book, going to the gym. So that's 1, self-care. 2, practice mindfulness. mindfulness sounds like a big term, but basically it's just being in the moment, catching myself to say, where am I now? Take a deep breath.
Right.
It can help reduce stress
Absolutely.
and anxiety in total, overall. And another thing is connect with people, right? And so we're living in a society where I'm good all by myself.
Right.
I don't like people. What that can do is isolate us. And so you want to leverage on healthy relationships because you can make them your support system. Everybody needs someone.
Yeah.
Right? That's great.
And it's easy to get away from that with social media,
Yeah,
right?
yeah, absolutely. And then finally, just know that there's help out there. It doesn't matter what your background is, what circumstances you may be, whether you're an everyday person or in the spotlight, there's help out there. Reach out to professionals if you need it. And yeah, it takes a lot of courage to pick up the phone to even call for mental health care, but it's available, non-judgment free, Conscientia Health. We're here for you, and yeah, it's good with you.
Those are awesome tips.
Thank you.
And it sounds like an awesome approach to mental health care, Conscientia Health. Congratulations.
Thank
You're a very impressive woman.
Thank you.
Are you single?
Married.
You're married. Good for you.
Married. In fact, I just got married again to the same guy.
You got married again?
To the same-
What happened the first time?
Nothing. I just figured we need to do this again. 17 years later, we did.
Oh,
You had so much
renewal.
fun, you did it twice.
So much fun we did it.
Renewal of vows. Well, he's a lucky, smart man.
Thank you.
All
Thank
right.
you. It was nice to meet you, Mario.
Very nice to meet you. Congratulations
Thank you
on
for
everything.
having me.
My
Thank you.
pleasure.